All new, you're probably hearing a lot of information about keeping your family safe from the COVID-19 pandemic, but local doctors are saying people across the valley need to make sure that they're also paying attention to other health issues. First News reporter Simone Blair is live in the newsroom with more tips about recognizing heart disease. Simone.
That's right, Brandon. Earlier this morning, we heard from a cardiologist at Trumbull Regional about the importance of getting treated for heart disease even during the pandemic. Dr. Sean Bokta says that delaying treatment of heart issues is dangerous and can even be fatal. According to the CDC, heart disease is the #1 cause of death in Ohio, Pennsylvania, and nationwide.
Heart attacks and other heart-related problems tend to have a lot of long-term effects. For instance, if you have a heart attack today, even if you survive it, if you present late and have complications, it does increase your risk of death, a month or 2 or even 6 months down the road, as well as developing life-threatening complications such as congestive heart failure.
Dr. Bokta says that early recognition is key to treating heart disease. Let's take a look at some symptoms to watch out for. The most common symptom is chest pain, but Dr. Bokta says this pain could even travel to the neck or shoulders. He also says that if you're feeling dizzy or short of breath, that could be a sign of heart disease. Lastly, he says feeling sick to the stomach can be an issue. Dr. Bokta says that even though heart disease is so prevalent across the U.S., there are ways to prevent it, or at least lessen its impact. First, he recommends eating healthy. Second, he says that exercising and maintaining a healthy body weight is important. Lastly, he says that avoiding smoking will help prevent heart issues. Now, Dr. Bokta told me that there are some groups of patients that will have different symptoms. First, people over the age of 75, as well as people with diabetes, might have atypical symptoms. Also, women are often treated later than men because they have a higher pain tolerance. Dr. Bokta recommends getting checked out by a physician if anything seems off. At the top of the hour, I'll be back with how you should be approaching heart disease during the coronavirus pandemic. Live in the newsroom, Simone Blair, First News This Morning.